Why and how are health and illness considered social problems? What does life expectancy, mortality rates, morbidity rates, and other health related phenomena tell us about patterns of health and illness in society? How can problems with mental health be conceptualized as social issues? How does mental health influence social groups? What is the biomedical view of medicine and what does it propose? How about the biopsychosocial view? What about the social determinants of health model and how it can be used to help us understand the relationship between health and society? On this episode of Social Problems, we're talking all about health, illness, and substance use. So sit back, grab a snack, and let's get to it. My name is Dr. Derek Silva, and I'm an associate professor of criminology studying harm and injustice in the social world. On today's episode of Social Problems, we're talking all about health, illness, and substance abuse. Following Parsons' idea of the sociological imagination, health issues can be considered social problems as well as very personal concerns. The chapter explains the different perspectives that are taken to defining and understanding the relationship between health and illness. But before we get to that, there are a few important definitions we need to cover. First, we must define health, which can be characterized as a state of complete physical, mental, and social well being. Well being can be further distinguished as a positive state of existence characterized by happiness, prosperity, and the satisfaction of basic human needs, and not simply by the absence of negative conditions such as illness or injury. As we've seen clearly in the context of the COVID-19 pandemic, much of the medical discourse operates within the field of epidemiology. Epidemiology is an applied science that examines the causes, distributions, and control of disease within a population. Within this biological understanding of illness, researchers and practitioners tend to focus on the biomedical view of medicine. That is, a medical perspective that emphasizes Western scientific principles, defines health as the absence of illness, views the body as a machine that sometimes requires repairs, and promotes the use of therapeutic intervention to quote unquote cure disease and injury. This is very clearly a vital and important field, but within the social sciences, we tend to approach the social consequences of health and illness, and thus also disease and its distributions. In sociology, this has resulted in the development of an all-encompassing field called medical sociology, or the field of sociology that examines the social context of health, illness, and healthcare. This field tends to focus more so on the social environment that interacts with health and illness, and tends to lean more towards and builds upon what is called the biopsychosocial view of health and illness. This view is still a medical perspective that considers health and disease, but also focuses on how they are both products of interactions between the body, the mind, and the environment, which also includes the social environment. While the biopsychosocial view remains a medical approach and thus focuses on medical theories, hypotheses, and solutions to illness and disease, it is a view within the medical field that does begin to explore the social consequences of health and illness. Within medical sociology, there are a number of important perspectives that, rather than approaching health and illness as a medical or biological phenomena first and foremost, approach health and illness as social issues. To be clear, this is not to suggest that medical sociologists hold that there is no value or purpose of medical views. Much the opposite. They suggest that there are actually tons of reasons why we should focus on health and illness first biologically. But sociologists hold that it is for other experts to determine those. The sociologist is there to explore the social consequences of any phenomena, including health and illness. From this perspective stems a number of important views. Firstly, there is the population health perspective, which is an approach to health that focuses on social determinants of health, and therefore on preventative societal strategies and social responses to health problems. This perspective makes use of perhaps the most important model in medical sociology, the social determinants of health model, or SDOH, which outlines the complex and importantly causal relationships between various social, economic, and political factors and population health outcomes. This view holds that there exists a causal relationship between various social, economic, and political factors and population health outcomes. In other words, that one's social environment causes health, illness, and even disease. Consider the example of the COVID-19 pandemic. Certainly, the SARS-CoV-2 virus is a biological phenomena. It is a virus that has genomic and biological traits that infect the body and do damage. But would there be a global pandemic if society didn't create the social conditions for its spread? What if the entire world grounded all travel in January of 2020 or even earlier, when the first reports of a novel virus first emerged? Would this virus have spread all over the world and infected hundreds of millions, if not billions, and killed millions? Perhaps we can consider a less large-scale example, and consider how low socioeconomic status might lead to something like diabetes. We know, based on evidence, that there is a strong causal link between low socioeconomic status and diabetes. Why might this be the case? Well, research suggests that many of the food patterns associated with obesity and diabetes are also associated with lower income levels, less time at home to cook meals, and fewer food choices available in geographic areas. We also know that in lower SES areas, all of those variables are impacted in the same way. Those in lower SES areas tend to have less food education, fewer food choices, and the choices of available food within an affordable price range tend to be calorically dense foods like chips and high sugar sodas. Finally, we also know that health and illness are heavily racialized, even in Canada. Black, Indigenous, and other people of color tend to have higher rates of morbidity and mortality, lower life expectancy, and much more negative health outcomes throughout the entire life course. This, as medical sociologists remind us, are due to a variety of structural issues. These are often called social comorbidities. There are also comorbidities that are much more biological, and these are the susceptibility of an individual with an illness to additional health problems. While diabetes and other associated illnesses have biological and medical characteristics, they are absolutely conditioned by the social structure. This is what medical sociologists tend to focus on, the connections between health, illness, and society. It is important to determine how social determinants of health, whether they be social, economic, or political factors, can influence health outcomes in an entire population. For your read, watch, and respond, please answer the following question. What are the similarities between the biomedical view of medicine, the biopsychosocial view, and the medical sociology view of health and illness? There are a number of measures that sociologists use to shed light on health and illness in society. These include, but are not limited to, life expectancy, mortality rates, and morbidity rates. Life expectancy is a measure of the average number of years remaining in a person's life at any particular age, given current age-specific mortality rates. This is ultimately one of the most important measures of contemporary life. How long can we expect to live? How do we make that longer? And what are the consequences to making that longer, or if it's shortened? How do different areas of the world compare on this measure? All of these questions inform a number of social and public health policies. But it's not just about life expectancy. There are also a number of mortality rates and morbidity rates that we use to add nuance and complexity to how we measure health, illness, and disease. This includes the morbidity rate, or the extent of disease in a population reported by incidence, i.e. the number of new cases in a given population during a given period, or its prevalence, which is the total number of cases of a disease in a population at a particular time. Sociologists also measure the mortality rate, or the death rate associated with a given disease or a population, typically measured as a deaths per year per 1,000 people rate. The mortality rate can then be broken down into different subgroups, like the infant mortality rate, which is the number of deaths of children under 1 year of age per 1,000 live births. The maternal mortality rate, or the number of deaths of women due to complications during pregnancy, childbirth, or abortion, typically measured as deaths per year per 1,000 live births. The maternal mortality rate, or even the under 5 mortality rate, or the U5MR, which is the number of deaths of children under 5 years of age per 1,000 live births. The chapter also draws attention to mental health and argues that mental illness and disorders are social problems that interact with several social institutions, including the family, economy, education, the workplace, and almost every other social environment. Mental health is defined as the capacity for people to feel, think, and act in ways that enhance the quality of daily functioning, the range and depth of social relationships, and the ability to adapt to life changes. By contrast, mental illness is thus a clinical diagnosis of mental disorder requiring medical or psychotherapeutic treatment. A mental disorder is defined by Health Canada as a condition, quote, characterized by alterations in thinking, mood, or behavior, or some combination thereof, associated with significant distress and impaired functioning over an extended period of time. Mental health has, for very good reason, come to the forefront of both the biomedical view of medicine and medical sociology, because as we now know, there is an absolute pandemic of mental illness that has emerged in contemporary life and has been really exacerbated and illuminated by the COVID-19 pandemic. By the way, if any of you is struggling with anything related to this course, to university, or school in general, please know you can reach out to me if you need anything. There are also so many amazing resources at King's and at Western to support you and your health, and I urge you to explore those options and reach out for the support if you need it. There appears to be certain populations that are more likely to experience mental health concerns than other populations, which highlights how sociocultural factors influence mental health. We know that, for example, by age 40, about 50% of the Canadian population will have struggled with some type of poor mental health. In any given year, 1 in 5 people in Canada will experience a mental health problem or illness. Suicide accounts for nearly a quarter of all deaths amongst 15 to 24-year-olds, and 16% of those aged 25 to 44. It is one of the leading causes of death in both men and women from 15 to 44. Mental health problems tend to disproportionately impact racialized and marginalized individuals and groups, those who are suffering from homelessness or housing insecurity, those who suffer from poverty or low income and financial insecurity, and incarcerated folks. Economically, the cost of mental health in Canada for the healthcare system is estimated to be over $11 billion annually. There's also a strong link between mental health and substance use and addiction. Addiction is defined as socially disapproved behavior that is uncontrollable, repetitious, and possibly harmful. This often, but not always, relates to harmful substances like alcohol and mind-altering drugs, but can also take a number of other forms like gambling. To be clear, a drug is defined as any substance that causes biochemical reactions in the body, including ones that might be productive for the body in certain contexts. Indeed, sometimes drugs are used to help in one case and lead to harm in another. Consider the trend in elite sports to help athletes cope with pain through using pain-killing drugs. As TSN's Rick Westhead has documented, the use of such drugs to help has actually had a negative impact on the lives of so many athletes, causing some to become addicted to those painkillers for coping with everyday life and even mental health issues. As NHL players develop a tolerance to painkillers, prescribed to deal with hockey-related trauma, and tolerance here is defined as a symptom of repeated and frequent use and refers to the decreased effectiveness of any given drug, they slowly become drug dependent. Drug dependency is perhaps best characterized as the routine need for a drug for physiological or psychological reasons. This often, but not always, leads to drug abuse, or the excessive or inappropriate drug use resulting in social, psychological, or physiological impairments. It stems from a chronic physical and psychological compulsion to continue taking a drug in order to avoid unpleasant withdrawal symptoms. So even when the drug might be condoned, accepted, or even helpful, it can often lead to harmful or problematic use of drugs in the future. This is the case not just for NHL athletes, but also a broad pattern across society as a whole. A number of medical sociologists have found that this is partially caused by a long standing process of medicalization, which is the process whereby the medical profession comes to be viewed as being relevant to an ever widening range of traditionally non medical aspects of life. As we medicalize more and more of everyday life, there are consequences for society and folks within it. For your read, watch, and respond, please answer the following question. What is medicalization, and how does it illustrate the social construction of health and illness? For structural functionalists, health is normative, which means it is established and derived from a standard or social norm. In other words, health and illness are impacted by your behaviors that do or do not violate norms and socially constructed expectations. Health is maintained by social institutions and structural relationships. Healthcare is the social institution responsible for maintaining well being of all members of society, and thus the society as a whole. Illness is thus a form of deviance that threatens the ability of society to function properly. For functionalists, ill people often adopt what is called the sick role, which allows them to temporarily withdraw from society while they recuperate. Functionalists see this as a dysfunction that threatens the stability of many social systems, including healthcare and the economy. When it comes to addiction, functionalists see alcohol and drug abuse as resulting from the social structure's influence on the individual. Drug and alcohol use is common because it serves social functions that promote social bonds and cohesion. Because they're highly addicting, drug abuse is sort of a natural byproduct of this. For functionalists from the social disorganization theory perspective, addiction is often associated with rapid social change because institutions that traditionally discourage deviant behavior are rendered less effective. A breakdown in community norms and traditions deprives people of a sense of meaning and moral guidance. Relearning or reestablishing traditional institutions can, from this perspective, reduce substance abuse and addiction. Recall Merton's strain or anomie theory from the last episode. This functionalist perspective holds that drug and alcohol abuse is the result of an incongruence between culturally defined goals and socially approved means for attaining those goals. This conflict is called anomie and causes a sense of normlessness that can be easily replaced by addiction in order to cope. One adaptation to this gap is to retreat or to abandon both the accepted goals and the institutionalized means to escape reality via substance abuse. Conflict theorists, on the other hand, view problems in the delivery of healthcare as the result of the capitalist economy, which sees medicine and health as commodities that can and should be sold and purchased. As they do in so many contexts, people struggle over scarce resources such as medical treatments and pharmaceutical therapeutics. Health, healthcare, and health research are affected by wealth, status, and power, or lack thereof. You can quite clearly see this approach in the global COVID-19 vaccine rollout, where according to Bloomberg, the wealthiest 27 countries in the world have amassed 30% of the total vaccinations. For conflict theorists, alcohol and drug use affect different socioeconomic groups differently. Powerful capitalist members of society are in a position to define whether a substance is legal or illegal in the first place, which allows them to control addiction in a variety of ways. The poor tend to suffer harmful outcomes of substance abuse much more than the rich, due to both the process of labeling, which results in stigmatization, and the criminalization process. Symbolic interactionists see unique meanings and experiences that are associated with specific illnesses with being labeled as sick. What constitutes health or sickness varies from culture to culture and has completely different meaning systems. Crises in healthcare are indeed socially constructed notions that can and have been used to promote certain political objectives and ideologies within society. Symbolic interactionists hold that the social meanings and values associated with drug and alcohol, and the labels that we use to attach to people when they use these substances, are incredibly important. The terms alcoholic or drug addict are embedded with negative characterizations, judgments, and stereotypes, in a way that, say, a social drinker is not. These approaches have lasting consequences throughout the social structure, including in the criminal justice system. Finally, feminists hold that gender and intersectional oppression are important social determinants of health, illness, and even substance use and addiction. Women's health has often been defined and understood on the basis of patriarchal systems which embed biomedical approaches created by men, their norms, and their expectations. For feminists, the entire health system is reflective of the patriarchal system, which does not allow for the nuance and complexity needed to handle problems for women because it is structured on this patriarchy. Accordingly, nobody understands the female body like women do, and that needs to be built into the structure of healthcare in order to deal with differential outcomes of health and illness. For your read, watch, and respond, please answer the following question. What does it mean when feminists say that health and illness are gendered? Well, that's it for today. I hope you learned something about health, illness, healthcare, substance use, and addiction. This has been Professor Silva, and I'll catch you on the next episode of Social Problems.